By the end of this video, you should know more about polio, its history and epidemiology, know why vaccinating against polio is important, know what to do when you suspect polio in a child, know how to collect a stool sample, and know how to notify acute flaccid paralysis on the Notifiable Medical Conditions app or case notification form. Poliomyelitis, or polio, is a viral infection that used to be prevalent around the world. However, vaccination has brought about a decrease of more than 99% worldwide, from an estimated 350,000 cases a year in 1988 to only 5 reported cases in 2021. While there is no cure for polio, it can be prevented through vaccination. The polio vaccine is safe and effective and can protect a person for life. Currently, the polio vaccine forms part of the Expanded Immunisation Programme, or EPI, in South Africa. Vaccinations should be administered given at birth at 6 weeks, 10 weeks, 14 weeks, and 18 months. South Africa was certified polio-free in September 2019, and the continent of Africa was certified polio-free in 2020. However, there are still countries where polio occurs, and clinicians must be vigilant in detecting and reporting possible cases. Clinicians and community health workers working together can ensure that immunisations are conducted and followed up on as per the Road to Health immunisation card. There are 3 different strains of the polio virus. Wild-type poliovirus 1 causes epidemics most often. Wild types 2 and 3 have not been detected in many years and have been declared eradicated. In South Africa, the last confirmed case of wild-type poliovirus was in 1989, but polio still occurs in countries where there are inadequate vaccination programs, and there is a considerable amount of migration and travel into Africa and South Africa. We should remain on guard to ensure we keep the virus at bay. The virus mainly affects children under 5 years of age, but anyone who has not been vaccinated against poliovirus can get it. Poliovirus multiplies in the intestine and is shed in the feces. It is transmitted primarily from person to person, mainly through the fecal-oral route, but on rare occasions, the virus may spread through contaminated water, food, or other substances. Transmission is possible for as long as the virus is excreted. In the throat, the virus can persist for 1 week, and in the feces, it persists for 3 to 6 weeks. The incubation period is commonly 7 to 14 days for paralytic cases, but a range of 3 to 35 days has been reported. Cases are most infectious during the days before the onset of symptoms. Over 70% of cases are asymptomatic, while 24% of cases have minor transient illness characterized by several days of fever and flu-like symptoms, including fever, malaise, drowsiness, headache, nausea, vomiting, and sore throat. 4% of cases are classified as non-paralytic poliomyelitis, which begins as minor illness for 1 or 2 days, then progresses to include severe headaches, stiffness and pain in the neck, back and/or limbs. This lasts 2 to 10 days and recovery is usually rapid and complete. Fewer than 1% of cases result in paralytic poliomyelitis, which is characterized by minor illness for several days, then a symptom-free period of 1 to 3 days, followed by rapid onset of flaccid paralysis with fever and progression to the maximum extent of paralysis within a few days. Paralysis of respiratory and swallowing muscles can be life-threatening, and an estimated 5 to 10% of those who are paralyzed may die when the breathing muscles are immobilized. If poliomyelitis is suspected, a definitive laboratory diagnosis requires the isolation of poliovirus from patient stool samples. All suspected polio cases must be admitted to hospital, and all the patients in the hospital that have had contact or originate from the same neighborhood as the confirmed case should also be isolated. When collecting specimens, the South African Acute Flaccid Paralysis or AFP case investigation form must also be completed. This can be found on the National Institute for Communicable Diseases (NICD) website, but should also be available in primary healthcare facilities. To properly test for polio, the clinician should collect 2 stool or fecal samples 24 to 48 hours apart and within 14 days of the onset of paralysis. These should be collected in specimen collection bottles, the same ones used for urine or sputum. The samples must reach the NICD within 3 days of collection. Where stools cannot be obtained, a rectal swab must be submitted for testing. All sections of the case investigation form for acute flaccid paralysis or AFP surveillance must be completed and accompany specimens. Immediately upon collection, samples must be placed in a poliovirus-dedicated vaccine carrier or cooler box with frozen ice packs or in a refrigerator if available. The cold chain must be maintained at all times during the storage and transit of samples, and the first specimen may be refrigerated until the second specimen has been collected. The relevant forms for specimen testing at the laboratory must be completed accurately, and the clinician should make sure that all information is correctly documented with the patient details. Both the N1 laboratory request form and the case investigation form for AFP surveillance should be filled out if polio is suspected. Ensure that all specimen bottles are correctly labelled and the specimen is stored and transported according to the specifications in the Primary Healthcare Laboratory Handbook. This booklet also describes how to ensure that non-expired stock is used and how to dispose of expired stock. It should be noted that acute flaccid paralysis is a Category 1 notifiable medical condition, or NMC, because it poses serious health risks to communities. Every doctor or nurse or healthcare provider in both the public and private health sectors who diagnoses a patient with any one of the NMC must report the case. Failure to report an NMC is a criminal offence. Refer to the NMC video in this series to learn more. Thank you for watching this video. Please remind patients and community health workers that childhood immunisations are important in the prevention of poliomyelitis. Please remind your colleagues that all children should receive their immunisations and, if missed, should receive catch-up vaccines. Notifiable medical conditions need to be reported. TB screening is important. HIV testing is important, as well as ARTs for all those testing HIV positive.